friends, I am Dr. Harvinder Singh and we are back with our next video discussion, which is comparing these two formulations of Asenapine, which is the transdermal versus sublingual formulation. Well, we know that Asenapine has a very strong first pass metabolism, so the oral formulation will not work. That's why initially the sublingual formulation was introduced. We'll talk about that in a few minutes. But I will try my best to focus my discussion only on these two formulations. And if you're interested in learning more, I will put some links below. You can read more details. But let's start with the history of Asenapine. We know that it received its FDA approval in 2009. And at that time, the sublingual Asenapine, the other name is Saffris, that many of us know, it was FDA approved only in adults for acute management of schizophrenia and bipolar 1 disorder, mainly manic or mixed episodes, not for the depression episode. So that's number one. So since 2009, it took them close to 10 years, 2019 moving forward. This is a time when FDA approved the other formulation, transdermal formulation of Asenapine, but this was only approved for adults with schizophrenia. It was not tested in the bipolar disorder subgroup though, so be mindful of that. And most recently, in 2020, a literature review was published on this topic. A systematic review assessing the transdermal Asenapine in schizophrenia. And this is the reference here, and I will be using this reference in my discussion moving forward. So, without wasting any time, let's discuss how are these two formulations different if they are different. So let's begin with the pharmacokinetics first. Well, starting with the Cmax here. So very briefly, we know Cmax is the maximum or peak serum concentration that this medication will achieve after it's given or administered. So, and I will explain the differences, how they are clinically relevant in few minutes. So you can see for sublingual Asenapine, it's higher at 4 nanogram per ml, whereas little lower for transdermal at 1.72. The next is Tmax, which is the time it takes to reach the Cmax that we just talked about. And I think this is very important difference here, and you will see this now. So sublingual Asenapine, it's 1 hour, whereas for transdermal Asenapine, it's 16 hours. Very evident difference. And the T half, which is the elimination half-life, is 24 hours for sublingual and 30 hours for transdermal. And the last difference is the ratio of peak to trough levels. So for sublingual Asenapine, it's more than 3:1. And make a note that this more than 3:1 ratio is the largest, is the highest among antipsychotic. So sublingual Asenapine has the highest, whereas transdermal is 1:1 ratio. Well, you will ask me, what does that mean clinically for me when we prescribe these medications? So here is the summary. So sublingual Asenapine, because of these pharmacokinetic features, is absorbed rapidly and have rapid onset of action, whereas transdermal Asenapine is more steadier with sustained delivery option. So You need to keep that in mind when you choose one medication over another. Now, the next difference that I will talk about is if there are any other factors that can affect the absorption or the Cmax, Tmax, or the level in the body. So the first is the food intake around the time you take these formulations. For sublingual formulation, I think it makes clear sense. It can affect the absorption of this medication if you have taken a food immediately around the time or drinking something that can affect the absorption. Whereas transdermal is definitely safe because it bypasses that pathway. The next is heated blanket. Now, for sublingual, no relation to that. But for transdermal asenapine, if, for example, in winter, if a patient has placed the transdermal asenapine and is using heated blanket, this can double the absorption. You will see how the Tmax went from 16 to 8 hours here. So very, very important factor to consider and educate your patients, especially if you live in, colder areas with snows and everything. And then you will ask me, can the environmental heat, like in summer, affect it if you live in more summer areas, more areas with more heat? Well, the answer is no. Both of these medications are safe in that. So on a hot summer day, you don't have to worry about it. But there is one more point that I have not written here is if you place this on a broken skin, the transdermal asenapine absorption will get affected. So, as we know, you have to change the sites with transdermal asenapine. And the other thing you need to be mindful of is not applying this on a broken skin. Now, we're almost there. The other difference, I think, which is more clinically relevant is plasma level of asenapine different with these two formulation? And this is what this literature review that I have already mentioned below answered. So there was no difference in the plasma level for sublingual or transdermal asenapine. And same goes for the efficacy. Well, the efficacy was similar for both sublingual and transdermal asenapine. Although I have not mentioned here in this slide, but I will say, the side effects were very specific for both the medication. For sublingual, you worry about mouth ulcers, bitter taste, and complex instructions, whereas transdermal have more of a rash and skin-related side effects. But overall, they were similar in efficacy there. I will finish my presentation now. If you're interested in learning more about the transdermal antipsychotic, we did posted on this topic in October 2019 when this medication received the FDA approval. The link is here, but you can also scroll up or down. I will place that link on the website page also. So friends, thank you for listening to me. If you're interested in learning more, do consider subscribing to our Physician's Guide for Clinical Psychiatry course. And if you have any questions for me, you can contact me directly at hsingh@psychiatryeducationforum.com. So friends, thanks again for listening to me. This is Dr. Singh signing off. Take care and bye for now.